Good afternoon, this is Jon Snow for 999 TV News. I'm reporting live from Downstream, where D-Man has rescued yet another patient from coronary heart disease. The public has come out in force to show its appreciation, but questions have been raised about D-Man's effectiveness in recent years. Each year has seen an increase in the number of patients drowning from chronic diseases like diabetes and CVD downstream. Many of these chronic illnesses have common risk factors, which if addressed early in life before the onset of disease, could prevent a lot of people getting into the river in the first place. Let's see what the locals have to say. Hello, Jon Snow. Did you know that you're named after a very famous epidemiologist? Anyway, I'm not actually from Downstream, I'm from Upstream. In Upstream, we think D-Man is wonderful. He's doing a marvellous job. However, in Upstream, we have a better view of the bigger picture. Instead of focusing our resources on trying to cure all disease, which in my opinion will never happen, we are focusing some of our research on trying to stop people getting into the river in the first place. We are looking at social and macro factors of health further upstream so that we can truly influence the determinants of health. We want to make the healthy choice the easy choice for the individual before it is too late. We also recognize that there are common risk factors for many of the chronic diseases which are crippling our health service. For example, CVD, diabetes, cancer, and dental caries all have shared risk factors. We think by working together and looking upstream, we can reduce the number of people falling into the river, so D-Man will have less to do downstream. If I could say something to D-Man, then it would be to explore what is happening upstream and check out those clever chaps at UCL.
People know that what causes the most diseases are things like smoking, diet, stress and so on. But what the upstream determinants are is why do people indulge in those behaviors? So what one has to look at is the causes of why people eat sugar, why they smoke so much, why they don't do exercise. And those causes are really to do with the environment that the person lives in. And it's very interesting looking at London that for each stop on the tube line going east, people's life expectancy decreases by about a year. And what one can say is associate with that is that the conditions along the tube from Westminster to the east gets worse and worse. So it's not that worse people live in those areas, it's actually the conditions. The upstream approach really looks at the factors that pushes people into the river upstream. And people don't just jump into the river, and they, particularly if they can't swim. So what is pushing people in upstream, as we saw on the diagram? And the question then is, they actually are called the manufacturers of illness. So this gets away from what is called the victim blaming approach, where you're blaming individuals for being lazy, eating badly, etc., and giving them more information about you shouldn't do this, you shouldn't do that. But what we should be focusing on is who's the pushers in it, who are the manufacturers of illness.
In an academic public health department, what we're doing is looking into research onto health inequalities, both in the UK and internationally. Because from public health, we know that the causes of inequalities, the causes of poor health, are linked to the broader social and economic determinants of health. So our research and our policy actions are looking at those bigger factors that are the underlying causes of disease and inequalities in populations. So, for example, some of our work is looking at nutrition and looking at the ways in which different chronic diseases are caused by unhealthy diets, high in fat, high in sugars, high in salt, and the range of commercial economic factors that cause people to eat unhealthy diets. And one setting that has not been utilised to nearly enough extent is the use of primary dental care, because dentists and dental teams see the general population, healthy adults, children, older people are routinely seen by dentists, but very little prevention is provided in that setting. So one of our projects is testing out a nutrition intervention in general dental practice that aims to reduce sugars consumption, both to promote oral health and to promote better heights and weights for young children.
Childhood obesity is a significant public health problem. Being overweight is harmful to young people's health and is linked to serious diseases in later life. The purpose of the SWITCH study was to test the feasibility of an intervention in a dental care setting using a motivational interviewing technique in young people aged 11 to 16 who were overweight or obese and consumed at least one soft drink per day. This research is highly relevant to the public health issues of today.